Very good evening. You're watching the India Development Debate. I'm Tamanna Inamdar, and the coronavirus has now officially surpassed SARS in the number of people impacted at over 8,100. 170 have died so far, and the big news of today, one positive case has been detected in India. A man in Kerala who studies in Wuhan University in China. Meanwhile, a plane full of Indians stuck in the Hubei province of China may land on our shores tomorrow. On the other hand, the WHO is still wondering, there's an emergency meeting going on right now, they're still wondering whether to formally proclaim the virus as a global health emergency. So is the world ready? How will India tackle the situation? That's the big story we're talking about right on top on the India Development Debate this evening. There's a lot more coming up, a variety of subjects we're tackling, but let's start with the coronavirus. And to talk on this, I'm joined now by Dr. Mahesh Devnani, Associate Professor at the Postgraduate Institute of Medical Education and Research, and Dr. A Velumani, Chairman and CEO, MD of Thyrocare Technologies. Welcome to both of you, and thank you for talking with us. Dr. Velumani, let me begin by getting your take on the fact that there has been one positive case in India so far. We know that there are a number of students who've returned from China over, the New Year break, the Chinese New Year break, many from Wuhan University. Is it safe to assume that this is unlikely to be the only positive case?
Very difficult to right now tell how many are positive. It is one which is detected and reported. Thousands have landed, and in different airports. They have gone to different parts, different states of the country. Probably Kerala was fast enough to find out and declare. And even in Kerala, out of 1,000 and odd passengers who have landed, they have made 15 to quarantine in a space specific, and the remaining are told to be at home quarantined. So this is one airport, one location. You can understand how big is the challenge, but we hope that it is much lesser in number, not it will grow exponentially and create a huge panic and alarm to Indian authorities.
And alarm are the key words, and they shouldn't be. Since this morning, I have seen so many fake forwards and messages on the reasons for coronavirus and what you should do to avoid it. One even says, don't eat kulfi. Don't believe these things, please. Dr. Devnani, I want you to stress on how not to believe fake news on the coronavirus. And I don't know who these people are who love to, create these fake news posts.
Yeah, Tamanna, good to see you again. And before I answer your question, I would like to say that detection of this case is not surprising. In fact, we were expecting, and it tells us that the surveillance system which is in place is working. In fact, there were some apprehensions earlier that why is India not being able to detect the cases when other countries were detecting. So this detection is answers to them. Coming to the fake news or the fake forward messages on WhatsApp or some other social media, we have to live with this today in this social media world. But one thing I would always stress is to do the fact check, and that can be done either by Googling it or visiting either a government website or the PIB's website, or on social media also. They have their Twitter handles, on the Facebook also. So it is always better to fact check.
Fact check is one part, but Dr. Devnani, more on the Kerala case, in the same question that I asked earlier. Is it likely that there will be more? Statistically, there seems there will be more. And how prepared are we as a system to contain whatever is happening? And that's the key, isn't it? Containment. I mean, right now there is a cruise ship off the coast in Italy with 600 passengers on it because one may have coronavirus. So everyone's just sitting there till you find out. How key is containment?
No, containment is the most important part, and with the detection of this case, and they will do the contact tracing, and a whole epidemiological investigation will be done. So not generally only the isolation of this case, but the quarantine of all the healthy people who have come in contact. And it is more challenging in such scenario where the person has taken an international flight and then might have taken a domestic flight and might have taken a train, bus, or an Uber and Ola also. So this is a challenging task, but we need to see how the situation emerges, and the health system is prepared for that because we already knew that this is coming. State and the various states and the center have put in place various measures, and the detection also tells that those measures are working. So there is no need to panic, I would say, but we will see how the situation emerges. But one thing I would like to underline is that with the best of the efforts and in the best of the health systems, such types of outbreaks do cause a considerable morbidity and mortality. Although with this virus, the mortality based on the data we have till now is quite low, it's about 2%. But because the transmissibility is quite high, the infectivity of this virus is quite high, which we measure in terms of R naught. This is a bit technical, but this tells us how many people one infected case transmits or infects. So this is, for this virus, is around 1.4 to 2.5. That means one infected case is actually transmitting on average to 2 people. So because the transmissibility is too high, so morbidity is going to be high. So what is worrisome is the social disruption as it is happening right now in China. Mortality may not be that high, except in some resource limited settings.
Okay, another point, Dr. Velumani, is about the right communication. We spoke a little while ago about how the World Health Organization is having an emergency meeting. They've actually had to apologize for, describing this virus as moderate earlier. There was a statement from WHO saying that this was a human error, and now they're deciding whether to call it officially a sort of a global problem. What is the significance of declaring this as a global emergency? What does it really mean? Does it bring more resources to the table? And what is your take on the WHO's role so far?
I think they have understood the virulence of this virus much later. Initially, they must have thought, let us not panic, and generally people would not to start with panic when they are not uncertain. They might have come to know later on that it's speed at which it is growing, the kind of mortality it is resulting into. But having said that, Wuhan is such an airport. In a day, 100,000 passengers are traveling through that airport, which says that not only in domestic China, internationally the traffic is much higher, and it is almost like a huge mall had a fire inside. No one knows how big it is, no one knows how serious it is, but it all is required is wisdom there, how to quarantine, a leader there, who will tell what will make things better. I believe the World Health Organization has much bigger role in even guiding individual countries, because it is not one or two countries, it is a global problem, and I hope they certainly bring a better orderliness on how to handle A, the one who can be suspected, and B, the one is suspected, the third one who is having an infection and need to be taken care of. It's a huge task. It's very difficult for me to say right now in India, are we having enough strength to handle it? It looks like the challenge is taller until the challenged becomes taller than the challenge.
Dr. Devnani, if you have any comments on WHO and the fact that there is a plan to evacuate Indians, as we must, from China, those who are stuck there in that province. But then the concern about quarantining them, that many people.
Yes, WHO has a role, and in fact, while we are speaking, an emergency committee meeting under IHR is going on right now to discuss whether this is a public health emergency of international concern. We call it FAKE, PHEIC. So we'll come to know in few hours what the decision of that committee is, because this committee advises the Director General of the WHO, and in fact, Dr. Tedros went to Beijing a few days ago to see the situation firsthand. So WHO has a role, and if even if the committee doesn't declare it fact today, I see that the committee will have to reconvene again and meet again to as the situation emerges. So on that front, I think WHO is performing well, and WHO has praised China's role as well, and it's whatever it has done till now. So we will see how the things emerge, but for now it is not a public health emergency, although around 19 countries have reported the cases, but the overall
This
cases
doesn't make,
outside
Dr.
China
Devnani, can you
is just
explain to me
1%
what happens
of the
once
global
WHO
tally.
says it's a public health emergency? What changes?
So more resources are poured in, and then the WHO coordinates a world effort in that. So right now the member states are doing on their own, and then the WHO would be the driving force, and they will be providing all the resources, and the UN will be providing these resources. So that has that will actually increase, but then we have to keep in mind that there are only 1% cases outside China.
Right.
So I'm not sure what would be the decision. We need to wait for that.
Okay, we're
Coming
waiting
to
and
the
watching,
second
we're
part of
tracking
your
that.
question
It
you
seems
asked
like
about
something the
Indians
WHO
trapped in-
should come in on. Dr. Velumani, just last very quick question to you about quarantining those coming in from China that India is rescuing, and ensuring that those who have come earlier as well are quarantined properly.
Now the biggest challenge here is the one who has to be quarantined. If he is not quarantined, it is a crime, and the one who need not be quarantined, if he is quarantined, it becomes a very big harassment. So it's not that simple. The numbers are too many, the entry points are too many. Having said that, virus is not new to the humanity. It has been there for centuries. Even if you see before the onset of this particular virus, there were daily not less than hundreds dying in the country because of specific virus, specifically having a respiratory attack or infection. So no need to get so panicked so early, but it is very important to keep monitoring and see by any chance if this virulence is not easy to manage, and then it should not become too late for us and we missed early steps of prevention.
Absolutely. The right diagnostic tools easily available at cheap rates everywhere would definitely be key as well. Thank you so much, Dr. Velumani, as well as Dr. Devnani, for speaking with us on the big story this evening.